I'll speak a few things about the gallbladder. Gallbladder is as important as the heart. Gallbladder lies in the right side of the upper abdomen. So I'll tell you one situation where people come to consult us or the gastroenterologist. They come with their master health checkup reports, and the ultrasound of the abdomen shows a gallstone in their gallbladder. So this is a common situation people come across, and we can say that we ask these patients when they consult us whether they had any pain in the past. So if they had no pain in the past and they have a gallstone at present, we need not do anything about their problem. So such a gallstone can be watched. We don't have to act. Out of 100 gallstones, 85% of the gallstones are symptomless. This is how they present. That means they have no symptoms, and such a gallbladder stones need not be operated. Out of 100, 15% of the patients have gallstone related problems, and these are the patients who present to the doctor as an emergency or some other symptoms. So I have told you one situation where patient comes with a report of a gallstone and who never had any pain. Now the second situation is the patient comes to the casualty or emergency room with an acute abdominal pain. Of course, gallstone is not the only cause of acute abdominal pain. There could be other causes, but one of the commonest cause is gallstone related pain, which is called a biliary colic. And this pain is experienced in the center of the upper abdomen or on the right side of the upper abdomen. And this pain can be quite severe and may last a few minutes to a few hours. And this is the common problem with which the patients come to the emergency room. And these patients are usually diagnosed by an ultrasound abdomen, which shows that there is a gallstone in the gallbladder, and the diagnosis is made. That means this gallstone has caused abdominal pain or biliary colic, and these are the patients who require removal of the gallbladder. Apart from causing pain, the other symptoms that the gallstone can cause is jaundice. That means the stone has not only entered the cystic duct, it has come into the bile duct. What is meant by bile duct? The bile duct is a communication from the gallbladder to the intestine. The gallbladder bile usually flows from the gallbladder through the bile duct into the intestine. So if the stone from the gallbladder drops into the bile duct, it causes bile duct stones, and this can cause excruciating pain as well as infection in the bile duct, which is called cholangitis, and this is a life-threatening situation. The second problem it can cause is the CBD stone or the bile duct stone can drop a little down further and impact at the area of the pancreatic duct and causes pancreatitis. Gallstones, which can cause pain, the CBD stones, which can cause cholangitis. So these are a series of situations which are all emergency conditions which needs to be handled. So the clinical features are the pain, jaundice, fever, pancreatitis, so on and so forth. So these patients need to be handled by the presence of stone, where exactly it is present. So we need to find out, is it in the gallbladder cystic duct, or has it come into the bile duct, or at the location at the ampulla. So based on this, the treatment is decided. If the stone is in the gallbladder and it has caused symptoms, it is a removal of the gallbladder. The stone has come into the bile duct, then endoscopic removal of the CBD stone followed by gallbladder removal, and if the stone has impacted the papilla, endoscopic removal of the stone followed by gallbladder removal. So these are the various things that are usually performed in patients, and there are usually some questions like what type of diets should be used in these patients. As such, the diet has no great role in gallstone disease, but sometimes even the patient becomes symptomatic. It is usually after a heavy meal that they become symptomatic. So overall, we need to understand that gallstone disease is quite important, and it is not only the stone in the gallbladder, it is the stones of the gallbladder that have migrated into the bile duct, caused several critical symptomatology.